I'm Alistair Greener. I'm travelling to Uganda with physicians across continents to see for myself some of the most medically deprived communities and how this charity is making a difference to so many lives.
Thank you very much, sir.
Thank you.
Along my journey, I meet the people of this vibrant country and witness hospital facilities, long overdue surgeries.
Get out. Yeah. He's feeling sick, yeah.
And see the challenges experienced by the people who live here. Many of us take for granted what we have when it comes to medical care. How long would it have taken for that to get to that size?
8 years.
8 years. The boy has malaria.
Yeah.
But how do the people of Uganda cope with the harsh reality of living on such limited resources? I'm travelling from London to Uganda. My first stop on this journey is the country's capital, Kampala. The first stop on my journey following physicians across continents is here at the Kabuli Muslim Hospital in the centre of Kampala. Now the surgeons are only here for a very short time, so they want to get as many operations performed as possible.
Physicians Across Continents is a newly registered charity in the UK, and it's been founded by a group of doctors. The idea was that through our training and through our education as doctors, we thought that if we concentrate on the educational and training things, which literally doesn't cost much to start with, and make our missions purely medical, in a sense that we either train people, operate on patients, do simple investigations in rural areas and in countries where they really need this.
The first patient we're going to meet is a little boy who's been brought to the hospital by his mother. He's suffering with water on the brain. Tell me a bit about your son.
Omwana wange namuzaala bulungi nga mulamu bulungi kati yatandika mpola mpola ng'omutwe gugenda gweyongerako.
That boy suffers actually from a fairly common neurosurgical condition in Africa, and Uganda is not an exception. This is called hydrocephalus. It's basically collection of water into the brain, and it's not going anywhere. So it keeps causing pressure on the brain from inside, and that ultimately affects the growth of the brain and affects the baby altogether.
Kati awo ne tugendako Lembale ne batugamba obukadde bubiri nga tetulina ne tukomawo ewaka. Kati ne tuwulira ekirango ku radio nti n'abazungu bali kujja eno balongoose ne tujja.
The pity thing here is that the baby is left until he's really too late. So you find a head size like this. And unfortunately, as I knew from my colleagues, neurosurgeons here, that the reason for this is not being able to diagnose it early, but no, it's been diagnosed early. The surgery was not carried out, simply the lack of the shunt, which is the tube.
You feel sorry when you see kids dying from diseases that are completely curable. They just die simply because they don't have a surgeon, or they don't have little equipment or device which doesn't cost much, not being available to them. So that's something you don't like to see.
I noticed that you didn't actually perform the operation yourself.
In fact, I was going to operate, but I found one of the junior neurosurgeons. She wanted to do that with another neurosurgeon. She asked me to observe her and criticize, what she does. I was very glad to do this, and because this is why we're here. So it's not lubing outside. This is a practical question in the exam. If you're feeling any resistance, what's going to happen? It means it's lubing outside the peritoneal cavity. Retract it, and then see the peritoneum. Dr. Julia, this is the most important step in avoiding complication. The tube is outside the abdominal cavity. You see, many times you think it is in the intraperitoneal, but it can come out easily. So make sure that you see the hole. Make sure it goes easily, slipping easily. If you're not happy, say, because this is important. Leave it up.
With the help of physicians across continents, I believe we can have many more neurosurgeons. There is still a great need, a very big need. And I believe if we can have 4 or 5 neurosurgeons in every one of the regions of the country, I think this is going to be one of the biggest dreams that Uganda will have, a dream fulfilled.
I've learned so many things from them. They are teaching us how to be more speedy, how to, the practices in theatre, because we have not gone anywhere like outside Uganda to learn more, and we would like this to go and learn more. Then we learn the techniques, especially the techniques for theatre, from them. And we are very happy when they are doing the surgery on our Ugandans. We feel very happy. This is why we work tirelessly so that we can finish all the patients screened.
Every time you go and do the surgery or you do the treatment, if you don't train local people, basically you have done nothing. We're not interested in operating on 10, 20, 30, 100 cases and then go back. If we don't train local people to carry on this business after we leave, we have done nothing then.
What would happen if this became more common?
It will help to reduce the numbers of the patient. It will help us to learn more from them, the visiting surgeons, and it will make Uganda a happier country with less problems in health.
I'm on my way to the Islamic University in Uganda, in the west of Kampala, to see the work physicians across continents do in educating Uganda's next generation of medical practitioners.
We had a chance to visit the university and give talks there, a couple of lectures, my colleagues and myself. We basically try to help in practical things, the latest in practical things. But when it comes to lecturing at a university, it's different. This is what we did. The university, you tell the students, the undergraduate students, you tell them things which may not be available to them now, but it will be available hopefully to them in the future. As a student, a medical student, it's nice to hear about it now, so that when it is available to him, at least he heard about it.
Epilepsy is not only, it can come after trauma, and it's quite common. You get just a seizure after that because of the disturbance in the electricity of the brain. When you look at somebody seizing, convulsing, you don't just take it like this, okay, he's convulsing. This is a layman response. But for you, you should look with perfect eyes and concentrate on what he's really having.
It
It was so good because we never get a chance to have people like him come to see us. I believe because maybe people with the qualifications are few in our country and maybe in the nearby countries. So today it has been like a great opportunity. He has come and we were so fascinated to have him, and we really enjoyed his lectures. They were so good, and at least we were able to coordinate what he talked about and what we get from class.
Under local anesthesia, to open the skull, which we can do sometimes for certain conditions where we need the patient to be awake during the surgery, then you do whatever you like and the patient is awake. And he gives you information. And we stimulate the cortex while he's awake. Of course, there are protocols for this. But we stimulate the cortex while he's awake by stimulating the leg area, then his leg will move. By stimulating the thumb area, his thumb will move. And if you ask him to talk and stimulate the speech area by reaching the hyperpolarization from your action potential membrane, what you do is you actually stop him. Many times in these operations, we ask the neuropsychologist or you, the surgeon, you ask him, David, count from 1 to 10. He'll start saying 1, 2, 3, 4, and then you stimulate. He doesn't know that you're stimulating. Once you stimulate, he'll stop at 4. Stimulation off, he'll continue 5, 6, 7, and so on. So because you're actually temporarily obstructing the function of that neuron in that area. So this is called awake craniotomy, and this is very important in epilepsy surgery.
It was such a great and important day in my life because principally the more you interact with good people in life, it's not what you get out of them, but the very best that comes out of it in the long run. Interacting with someone who is qualified, who has seen it all, it's such an inspirational moment. And with time, these are the people from whom we pick a leaf from that will always guide us and inspire us throughout in our life. It was such a pleasure interacting with a very senior person of a high profile, coming to share a word with us, words of courage, and trying to show us where the world is heading to. It was such a pleasure having him.
Most of our lecturers are local, with the exception of those who come from Nigeria, but almost 99% come from within Uganda. And most likely also, a couple of them are only trained from within. So you have such a person who was trained either in the US or UK, bringing a US experience, a UK experience to our students. It really adds a lot of value to our students. And I remember him introducing some concepts that they were not even aware of, introducing them to some technology that are new to them. And that is simply as a result of exposure. So such exposure really helps a lot because they make the students aware of what is happening, the developments in the field, and what they should expect in as far as their training is concerned.
What makes PACS, Physicians Across Continents, different from the rest of the charities perhaps, is that we concentrate solely on the medical education. Our aim is to offer high quality medical care and at the same time advanced education, advanced training. And these are the two areas we feel we excel at.
It's the final day of surgeries in Kampala, and just as the last patient is being treated, we hear about a desperate lady pleading for help. Could you explain what we have here?
This patient has a very large thyroid goiter, which most likely coming from the right side, so this is only right side goiter. You can see these small veins is congested vein, dilated veins due to the pressure from this goiter on the venous system going to the heart.
And how long would it have taken for that to get to that size?
8 years.
8 years.
8 years.
We usually see goiter much smaller than this.
Mm-hmm.
Even in the West now, you will see only 2 or 3 centimeter goiter. Now this is like 8 by 8 centimeters, so this is a huge goiter.
So the lady we met outside who presented herself with this goiter, which you can see, which she's had for 8 years, she's also HIV positive, and she has now been brought into the operating theatre, and the operation will start very, very shortly.
If the nerves, certain nerves, has been affected or cut, this means that the patient might suffer from either loss of voice, hoarseness of voice, stridor, or might be something even worse.
Because there's a lot in the body there that's very important.
This is the supply of the vocal cords. The supply of the vocal cords are next to this gland exactly. That's why they are very meticulous and careful. And unfortunately, all glands we see here in this country are huge size.
So they're determining what is part of the growth and what is part of the...
Exactly. Doing a dissection to make it easy to get the gland out. So we're cutting the muscles now to get the gland out. Okay. Here we can see the thyroid gland start to appear here, the middle area, or they call the isthmus. And these 2 loops will be soon ready, like delivery of. Okay. Here's the gland after delivery.
So would you say this is probably the most delicate part of the operation?
Exactly. That's why like 2 senior consultants are operating on such cases. Freeing the gland at this stage is really one of the tough steps in the surgery, during surgery.
This kind of procedure, it's not possible for most people in Uganda just to go along to a hospital and have this done.
I think so. I'm not sure, but I think so. Otherwise, why they're waiting all that to be operated upon?
Because it's an expensive operation, I presume. You have surgeons' time, there are materials, there are medicines.
I think it's costing a lot. If we compared with the income, their income, it's really minimal. So it costs a lot. They cannot afford the price for such a surgery. So they prefer just to wait.
And then, of course, you have the amount of doctors who could perform this surgery. Of course, you know, the physicians across continents, you have performed many of these, but I'm guessing a lot of doctors within Uganda haven't, so you don't have the experience.
Yes, certainly. I'm sure about the huge number of cases we have done before over the past years, but I'm not sure that the physicians here doing the same number, or they have enough experience to do such really difficult cases, It's now out, secured, have no bleeding. I wish there is no complication. And soon, we're going to start closure. That will take like 15-20 minutes, and then we'll be able to wake up the patient, make sure that there is no complications, and just send her safe to the recovery room.
Just before we leave Kampala, I want to go back to the hospital to see how Mastula is recovering from her operation. Hello, Nurse Rashida.
Hello.
Lovely to see you again.
Lovely to see you again.
How are you?
You're most welcome. I'm fine. How are you
Good.
doing?
Well, I've come to see Mastula, who was operated on yesterday, to see how she's getting on.
Mastula?
Yes.
Ah,
yeah.
she has already gone.
What?
She has already gone. She went at 11 in the morning.
But that's less than 24 hours.
Yeah, because she was feeling fine. There was no pain.
But 24 hours after such a major operation, is that normal?
Yeah, it is normal. It is normal.
Really?
First, there was nothing. She was not complaining of anything. She was very happy. And keeping the patients in the private hospital is costly. So She went, but she's okay. She will come back for review, like after 3 days.
So she was good? She recovered well from the operation?
Very, very well, and she said she had a very good, nice time with the doctors, and this was a golden chance for her to get the operation, especially by the whites. This is what she said. She was very much impressed.
And what happens to her now? Does she have some follow-up, or what happens?
Yes, she has. We have the phones. We give them the phone numbers, the mobile numbers. If they have any problem, they call. And he's supposed to come back for review after 3 days. But in those 3 days, if he gets a problem, he's coming.
Now, what about all the other patients? There was, I think, 57 patients they operated on. Where are they? I don't see anyone.
They are all like Mastula. They have already gone. Don't you see all the beds are empty?
Wow.
Those patients who were operated on, they were very much all right. They have been given their review dates. They will just come back for review. They're all right.
That's incredible.
That's when they discharge them.
That's incredible.
Yep.
Well, thank you so much for all your work and for looking after us when we came here. It's really kind.
No, we should thank you because you did a great job, because even those people who missed, they were crying. They are wishing maybe you come back, but we don't know.
Well, inshallah, we come back one day with the physicians to operate on more people.
Inshallah, Ya Rabbi, inshallah, inshallah.
Wasn't that fantastic news about Matsula? And imagine what difference it's going to make to her life after 8 years of suffering. But you know what, I'm still slightly shocked that she's been released after such a major operation within 24 hours. But I suppose that really just sums up the amount of pressure that hospitals like this are under. But bear in mind, this is a private hospital, so the facilities they have are way superior to the facilities that the majority of Ugandans are going to experience when they go to a general hospital. So as we come to the end of our time in Kampala, isn't it great to reflect on all those people who've been helped? 57 operations performed by the physicians across continents. And to hear how well they've done and to hear all those stories are really inspiring, but it's just 57 people. The question is, what about everybody else who is in desperate need, who are pleading for help? How much longer are they going to have to wait? Next time, I travel to Bavuma Island in Lake Victoria. Chikongo. I discover how limited the medical facilities are. Is it the father who has malaria or the boy? How do physicians across continents cope with the number of people pouring into the camp for medical attention?
Majority of them are told, you know what, it's incurable and you'll die.